your teams. So our topic today is going to be patient satisfaction surveys. So I know some people on the call have a lot more experience with these than I do. So I'm looking for some good interaction in our discussion today, and excited to hear what others have to say when we talk about some of the things that I have bringing up. So, okay. I know we have a few people that may not be able to attend, but I'm very appreciative for those of you who are here. So with that, we'll go ahead and get started. So the first thing I wanted to just do is tie this to kind of a why of um, with why doing these patient or client surveys. And so one thing that really came to mind for me was the NCQA, or National Committee for Quality Assurance, quadruple aim. And in that, they are wanting to, NCQA adopted the quadruple aim to foster healthcare system that delivers high quality, patient-centered care while supporting the needs of healthcare providers. So I really like that focus and aim. And I know that, for those of you who are working with me, that we've been working on enhanced primary care, that's part of the model that we use. That model that was PCTM is based on the quadruple aim. And clinics are very used to it. And for mobile integrated health, you guys are part of the healthcare system, the healthcare team in serving communities. So I'm sure it speaks to you as well, especially the pieces of high quality patient-centered care. So anyway, just looking especially at those first two, improving patient experience, enhancing patient satisfaction and care quality. So if we don't ask the people that we're serving, how are we really going to know how we're doing? How can we get their perspective? And today we'll go over a variety of ways that we can solicit their feedback. And then I think it really does involve the second, improving population health, promoting better health outcomes across populations. When our clients that we serve are feeling incorporated into having a say into their healthcare, they're better engaged, and we actually see better outcomes when they feel a part of all this decision making. Things aren't being done to them, but they have a say, and especially seeing any actions that are happening as a result of the feedback that they provide for us. So I'll skip the next two and just move on to our next slide. And I'm just going to go through some methods that I've found, and there's two slides of this. So the first method is using standard national surveys. I know some of our clinics have integrated this, the CMS administered hospital consumer assessment of healthcare providers and systems. So we can see why they call it HCAPS, because that's a long name. But it's it gathers comprehensive data from patients via email, phone, interactive voice response. So I'm going to forget that because people say IVR, so interactive voice response, or email, typically within 48 hours to 6 weeks after discharge or commencing services. It includes core questions on communication, timeliness, cleanliness, and overall rating. That's one, and we have I know kind of an example showing some of those types of questions that you would see for a HCAP survey, and our examples later in the presentation. So for the email or texting or portal-based surveys, those are delivered shortly after discharge and are usually, it's hopefully within 24 to 48 hours. And that's using tools like a Survey Monkey. And it's usually quick, 5 to 10 questions, mixing rating scales and open-ended responses. So there's also the more real-time digital surveys that are delivered via kiosks, email, or text, or mobile portals to capture things that are happening like during the patient journey. So maybe during the visit, whether it's, with you in the home as a person that's part of MIH or in the clinics. That's probably my favorite one, and we'll see that as we go a little bit further into discussion. And then also utilizing touchscreen devices or rating terminals. I don't know if any of you have seen those in healthcare, but I have an example of one I've seen recently and a picture that we'll see a little bit later. But those are just quick. You just touch and put, what your experience was with emojis oftentimes. And that's done immediately right before leaving. And then having apps or portals that are integrated into the healthcare provider system where patients can leave feedback at any time and not anonymously. And that's kind of nice because that one really incorporates the multi-language support and can be seamless for your electronic health record. So tech these days is really influencing how we solicit patient feedback. And it can be very painful or it can be really nice and swift and integrated. So let's see, moving on to the next slide. Oops, I went too far. Talked about that one. Okay. So another thing is using AI chat boxes or voice-based feedback. So that integrates the IVR. Who remembers? I forget already. Voice response, integrated voice response to automate feedback collection via phone. So we're all familiar with that. That's when you have it's a robot and it says, based on your recent visit, on a scale of 1 to 5, press this number in response to how satisfied you were with your visit, that type of thing. And it goes on. So you press 5 and kind of annoying. I know you guys might have that same experience of that. So then there's also the human calls. So staff reach out after at some point during care or after care. And it's really helpful for patients that are not very comfortable with anything digital. So they're just talking with you on the phone about how things went, human voice, so that you can be more interactive and response and how you're asking questions. So there's also healthcare leaders or advocates that meet in informal settings outside of clinical environments. This one is another favorite of mine. I know many years ago, we had individuals that were part of the clinic that I was a supervisor at, and they were just there for customer service. And so while they got hit all day long with lots of feedback, often negative, they did such a great job of being human and present and talking with people real time to gather what their concerns were. And then they would gather that information and get back to supervisors so that we could respond to the people, and rarely bring us in at the time if possible, but not as often. So that is another thing to think about. And then another favorite of mine, they're called patient advisory committees, but more integrated into the governing structure of healthcare organizations so that you have patients on boards, and so when decisions are being made for how to do business, they're providing feedback from the perspective of who you're serving. So that's really exciting to see. And I have seen that on a couple of occasions. So, and then there's also our social websites that are Google, Yelp, Healthgrades, and Facebook. And those platforms being monitored by individuals within organizations to see how we're doing and if there's any comments that need to be responded to. So I know that as a clinic director, I had the opportunity to respond to some of these um, types of feedback from patients. And it's nice because it was quick and easy for them to do, but also not nice because it was quick and easy for them to do. So you get a whole range of feedback. Sometimes people are just mad because of they didn't like what their provider said. So it has to be always kind of balanced. And we'll talk in just a moment about analyzing trends. That's really important. Like if you keep getting the same type of feedback over and over, as opposed to maybe one disgruntled patient who you can't fix their bill, we would like to, just encourage having more of that trending. And then another side of this goes kind of back to that quadruple aim of enhancing provider feedback is you want to balance the feedback you receive from the people you serve with your people delivering the care. So while I had training that taught me that the patient is always right, and you just, kind of apologize and try to move forward to what you can do to rectify the situation. I've also heard of situations where providers' actual performances are evaluated according to what patients are saying in social media websites. And I think that's really a difficult situation. So just a lot of things to weigh and balance when we're thinking about these different types of gathering patient feedback. And this is just a quick summary table of the different things that we just briefly covered. So we have the HCAHPS, and the timing is 48 hours to 6 weeks. Format can be mail, phone, IVR, or email. And it's nice to have because you can do benchmarkings with other organizations. And then digital surveys with text within 24 to 48 hours is a time frame that can be multi-choice and free text. It gives you fast feedback, trending, and an opportunity to do operational fixes. So when I think about our MIH partners, this one looks appealing as a consideration for how to do surveys. And then the kiosks or terminals are during the visit, and that's the smiley button ratings and an opportunity to provide more detail, like via a QR code. And then phone follow-up calls, post-discharge or visit, could be human or an automated voice, a digital touch, and detailed clarification. So the actual human person call, I think, we have some rural health sites that are getting really nil on their paper feedback or their emailed surveys. And so, for people that don't like tech or don't want to do that type of survey, a random few of the phone calls might be a good option. And then in-person sessions are scheduled and interviews and gives a deeper insight into systemic issues. Another story on that one, I once met with a patient who said they had been coming to the organization I worked for like 20 years, and they just love the organization, very loyal. But we had an EMR that we had recently implemented, and this person came in and said, oh, well, I just looked at this and all of my medications that were listed are wrong. And we hadn't really evaluated yet to look at it from, okay, what does it look like from the patient portal side when they see things? And there was a problem in the system. It needed to be updated. So having that opportunity to gather feedback from a person in that way that cares about the organization. And I just saw it as an opportunity to incorporate them into more of a long-term interchange where they would be willing to give of their time to look at changes that we were considering and provide feedback on how it's going from their perspective. Um, and then the online reviews, public posting, there's third-party platforms on that. And then the comment cards and suggestion boxes are quick and anonymous. They're easy. And you get you have those available in an ongoing nature. So there's the one I was telling you guys about. This was like leaving the restroom at an airport, and they just had a screen so you can just touch and there it is, and then you go. You can scan a QR code if you had something more to say. So I see this as some form or fashion as being valuable of gathering patient feedback on, how their visit went. Because even though it's so limited on what information is available, at least you're getting some information, especially for those who are on that know that they haven't gotten any surveys back at all, or very, very few. So you really have no idea how you're doing. It's like thinking outside of the box, if you will, on how we could gather that information from the people that we're trying to serve. Okay, so just a quick summary. I would encourage a mixed approach because people that are in our populations have different needs. So, a digital with an in-person, or a phone, or written feedback, different opportunities. It gives and also doing it promptly. Memory is fresh and specific examples can be provided. It's so hard. I myself as a patient have gotten an opportunity to provide feedback like even a week after the visit, and I'm like, too busy, can't do that. I think you're more likely the closer to the visit to get that information. And then brief is best, but there's that balance of the need to get some information with the need to gather information that's really actionable. And then offering anonymity, and can say it, anonymity, or optional, can help in getting honest feedback from people. And then last of all, I would say super important is acting, on feedback that you get. Like, everybody's busy, and so but you get this feedback that you've solicited, and you didn't get to it for a month, so the person's like, I gave you feedback, I put myself out there and you didn't even respond to me. Even a response to say, we got your feedback, we appreciate it, we are going to get together and see what we can do about improving that process. Just something. But also, as gathering your team together so they can get quick feedback. So it's like, hey guys, we got, this is what, we're seeing. Um, can we as a team get together and think about what actions we might want to take to improve that? And then following a PDSA cycle, to just say, okay, let's try what we think might help. And then go from there to see if it did help or not. And that's helpful when you're watching a particular trend. And so one of the trends that I think pretty much everyone has in common is access. So especially the clinics, they'll get feedback on access to care. Like, I can't get an appointment when I want it. I was told to see a specialty provider and I can't even get an appointment for 6 months. So there's getting that makes it feel sometimes like there's nothing you can do. But I know when we get a chance to have share outs, we can have some sharing about people who do deal with that as a trend and how they're focusing some quality improvement efforts on helping people that they've received feedback from to be less frustrated, if possible, about that. So you guys, there's some useful links here that I included in the PowerPoint. Some of the articles spend a little bit more time about explaining some of the different methods that I just discussed with you. They're really good reminders. Again, I know a lot of you have been out this a long time and have more experience than I do. So really would appreciate your feedback and your comments here. So I'm not sure who's on. So I see Kim Selsler. Okay, so Molly didn't know if she was going to be able to join. And so I will go ahead and skip ahead to show. So Catholic uses more of the HCAHPS type survey for going out to patients. And they are one of the clinics that I talked to that have had this ongoing discussions about, providing, maybe you can't do anything about the access, but you can provide information to someone who's really upset about it to explain potential other options. And then even while waiting, that they can't really see a plan to put in place. They recently, so they've had difficulty with access to primary care providers for Cadlet Clinic. And what one thing that they've done, especially to help patients that have just been discharged from the hospital, is to have a bridge care clinic. And so they've developed this so that they have a way, because all the primary care providers' schedules are so busy, that they have a way that they can schedule patients to see a physician at the bridge care clinic to get that follow-up visit that's so important, to be close to their discharge and make sure they understand everything, see how they're doing, if they have questions about the medication. So they just opened this week, and it's very exciting to see. So that's kind of an example of a problem they've known over time, that they've received feedback on consistently. There's definitely a trend, and they had a longer term solution to that issue. So I will. So Kim Selsler is on the line with us, and we talked a little bit yesterday about their survey. And so I will have you go ahead and, if you wouldn't mind, Kim, speak to this a little bit, what you guys are doing.
Can you hear me okay?
I can hear you. You're breaking up a little bit.
Okay. Yeah, that's, I'm having a really tough time.
Okay. Let me see if I can look at my notes from talking with you and Stacy yesterday and start, and then you can fill in. Maybe that'll be less time for you to have to talk. Okay. So with the patient satisfaction surveys, we talked yesterday, and the surveys are done, and the rate of return is pretty low. But one of the things is they have an outside company that helps with getting the data aggregated for them. It's called Crossroads, and Crossroads makes 6 patient calls per provider per quarter. Okay. And so they just keep trying to call, and hopefully they can get it. But if it's not complete 100%, that doesn't count in their percentage of surveys. So that's one thing, that it's low. But they can get the data because they use this third-party vendor, and it's sliced in different ways, so they can look at it by comment, by provider, or by individual clinic. So it's really nice because they can find trends and look at things in a different way. So, and Kim is the clinic, and she's just put a note in the chat to say, they also have like an opportunity for patients to provide feedback by comment card. Really simple, just a comment card. There's a little box in the waiting area so that they can provide comments. So I'm seeing what her chat says. She said she gets more response from comment cards left around in the lobby than she gets from Crossroads, and it's more in the moment. So there are problems that she can address right away sometimes, or definitely sooner than waiting for a quarterly report from Crossroads. So that's a good example of blended. So Kim says too, she gets a lot more positives. So that's another aspect I really love, is giving patient feedback that is positive to the people that are delivering the care right away, and in some great fashion. Like, hey, you just call them right away, or go visit the provider or nurse or whoever's delivering the care and say, this, you just got some really great feedback. So celebrate that. I was visiting a clinic once and they actually had a screen up in the area where patients go into exam rooms, that so that medical assistants and physicians and techs, everybody could see. And what they did was put only the positive feedback that were comments. They had a kiosk so they could do emojis, but they also had an opportunity for people to put in comments. And so whenever there was positive comments about the team, it would go onto the screen and just keep scrolling the positives for that day. So it was really in the moment. And it would say, um, it was so, I'm so happy when I come here and you guys are always so attentive and positive or whatever. They're seeing that while they're working. And I loved that. I thought that is just such a great way to encourage and know that there is good and feedback as well as opportunities for improvement. So Kim said that she gives the option for them to leave their contact information so she can call them. And she said she posts all the positives in the clinical area. So same idea, but with just paper, which is great. I love it. It's so simple. You don't have to rely on all this technology. So appreciate that, Kim. So is there anything else, Kim, that you want to share with us? Not seeing anything on our chat. So I want to move on to Danielle from Kittitas County Fire District 6, because we had a discussion about a survey that she has access to. So I wanted to have opportunities to share what works well, what doesn't work well, and kind of share that information amongst each other. So Danielle, do you want to go ahead and speak to that?
Yes, I think. Can you guys see my screen at all? Can you guys see my survey?
I don't see it, Danielle. I'm in a different kind of sharing mode, so let me maybe figure out how to stop. Okay, now go ahead and share.
Okay. Here we go. Can you see it now?
Yes.
Okay, awesome. So this is our District 6 community medicine. It's our exit survey. Basically, we just want to know, did our patient have a positive experience with us? Did they feel like it helped? Did it make a difference? Um, but I'll be honest with you, what we're running into is that most of our patients, they either pass away or they move away. And if they've moved away, for example, into assisted living, most of the time it's dementia related. So we're trying to see if we can get like maybe the primary family or giver to assist us, or the primary caregiver. So that's kind of what we've been doing. And then if I switch over, can you guys see that I switched over my survey?
Yes.
Okay, so this is actually ours is modeled after the Kittitas County Health Networks survey. We basically looked at what they were providing, and a lot of times, I don't know if there's anyone on from KCHN, a lot of times they meet with somebody, they assess, they help that patient meet their goals, and then they'll check in much less frequently, and then they'll wait for that patient to contact them. So for us, we said, well, we really don't give anybody up. I'll be honest with you, we just, instead of seeing them every day, then it goes every other day, then maybe once a week, then once every 2 weeks, once a month, that type of thing. And we have a handful of individuals that we meet with, even just once a month. And we could go 6 months without really helping a whole lot, but we still kind of keep them in our flock because they may be okay now, but they're not okay a month from now. They're not okay 6 months from now because they have new medications or they have a new medical challenge that they're trying to address, something along those lines. So we tend to not really give up our patients. And then when we scroll down, we included what our purpose is, and then all of our survey information, or if somebody wants to give us like a really big kudos, or they have a major problem, which we haven't had yet, then we actually direct them to our chief. And that way that chief can have, he may know like a slight background of what's going on, but he probably hasn't met this patient before. If he has, it's only been like once or twice. And then he can kind of mediate if needed or follow up and say, hey, let's change how we do this. Let's change how we communicate this particular way. For us, we can print this and give this to somebody. Electronically, we haven't done that externally. Internally, we've done surveys around the department. So if somebody said, can you just send me an email link, we could absolutely adapt this into an emailed link. That's not an issue, but we haven't ran into that yet. So I mean, we would pay attention to this, and we know our patients so well because we see them so often. We're in their personal business, medications, medical history, family dynamics, and stuff. So I feel like we would know pretty well if somebody had a challenge with us or a problem. But for the most part, I think that in a different circumstance, a survey like this would be really beneficial for us.
I like this, Danielle. Thanks for showing us. And what I like is about the simplicity. So it's kind of some of the concepts that we talked about it's just like a checkbox. And then there's an opportunity to provide more information. And that would be pretty easy to gather as far as looking for I like that I understand my individual goals because that would, if it said no, then it would bring about, okay, how are we doing that? What could we incorporate? So, with clinics, we've been doing this for so many years. With MIH, I know we haven't. And so it's an opportunity to implement what you think was most valuable and to track and trend on that. So, anybody out there have questions for Danielle on what they're doing or what they're doing with the information that they get?
So I have I guess just a general point when it comes to surveys. How do you account for? I feel that people are more likely to fill out a survey when they have something negative or a negative aspect to say rather than, hey, you did a great job. I know personally, I'm more likely to say something when I feel that whatever service I was paying for or whatever service I expected didn't live up to the expectation.
Mhm.
So I feel that most of our clients that we work with are behaviorally complex. A lot of them lack, I think, complete understanding of maybe all the nuances. Today, there was Travis and Nalia helped the same patient out twice today. He was an asshole twice today to them, even though they significantly helped him and they had to have a very real, very raw, hey, you're in a shitty situation because you're being an ass to everybody. So now if we said, can you fill out this survey? He's not going to say anything nice to them. So,
Absolutely, Cody. And that's the same point. I think you might have missed the first part when I was talking about social media.
mhm,
So, that's another way to gather, solicit feedback. So I think, it is what it is. Like, with what you gather that that would be your baseline, right? And your clientele, so your baseline is going to have a lot of potentially negative stuff in it.
mhm,
But it's been also my experience that it's not only the cranky people, but it's the delighted people. They want an avenue to
Mhm.
it's kind of both ends of the spectrum. And then the people that are like, you didn't bother their day, you didn't make their day, they don't do anything. But that's kind of what as you like, you don't we this isn't like the only way to evaluate what you're doing. It's just a way to solicit more information and maybe uncover something that you might not have known otherwise. So as a team, you're like, oh yeah, we got that. I know who that is. You can read it and know who it is.
mhm.
Yeah,
Um,
I think that I would agree with that. I would say if we've got 100 people this year that are like, you guys are on top of it. This is awesome. We love this program. And then I have that one person who's upset. I really don't care about that one person. I mean, like, I'll read it and I'll understand it. An example is we have a gentleman that called us today and he's really upset because he wants someone to come clean his apartment, but he's also an active drug user. And of the few resources we have for that, none of them will go in there because it's not really safe for them to do that. And so when I explained that to him and said, "Hey, what else can we do today? You know, have you eaten today? Have you taken your meds?" He's like, "Well, I guess you'll just have to get me a coffin." And then he hangs up. If I sent him a survey, I wouldn't get a very good survey, but I got another 100 people that are like, "You're the bee's knees."
I'm
So I
just
get what you're
cynical enough.
saying.
I would say, here's the contact information to the mortuary. Would you like to arrange that?
He hung up on me and then didn't answer. So I mean, it's the first time that we've really ran into that because we don't
Yeah.
have a big population of users. But at the end of the day, I don't necessarily have control over that. But if he contacted my chief, for example, I would just explain, the situation and be like, I really don't know what else I can do. He keeps hanging up on me. Unfortunately, I can only do what I can do. Um, so I would probably ignore that. I'd ignore that random one.
Yep. Good point though, Cody. I appreciate you bringing that up.
Yeah, I just think I appreciate the conversation. I just think that if we did surveys based on a lot of our contacts with people and said, "Hey, city council, here's our data about how great we're doing," they're going to be like, "Why are we paying you to do this stuff?"
Yeah.
Like, I don't think that maybe it's more of our unhoused, our patient population in Walla Walla that we work with predominantly. I don't think that surveys would probably, I almost think we would have to break that out into unhoused populations, substance use individuals. Here's our reputation amongst that patient population. Here's our housed, Medicare recipient fall patients that, we're working with and everything too. So
Yeah. That's good. And I'm sure the clinics could speak to the same kind of the same thing. I felt like that, Cody. A lot of times it was the patients that they couldn't get the meds they wanted, or there is some of that, but there's still value. It's when you do it over time. I like the comment cards, like how simple that is, and that there's some valuable information in there. So keep an open mind. We'll see. But I know there's another person on who has strong feelings about surveys. And Kim, Emery, if you want to pipe in, go ahead. But also, I just want us all to balance, like, well, keep an open mind about what could we gather, or the value of maybe a different strategy of how we do it. And then with the downsides, because your downsides are spot on. But Kim, do you want to weigh in?
Well, I probably need to take that to heart when you said keep an open mind, because I hate surveys. And there's actually a seminar I went to once about providers being, getting bonuses for having good surveys and everything like that. And the example was about following guidelines and following what you're supposed to do and not giving the person antibiotics when they don't need them. And then if you get a bad survey and then you don't get your bonus and your team doesn't get your bonus. So do we want to do good medicine, or do we want to do medicine to make people happy? And that's a really sticky situation to try to navigate your way through, to figure out, where am I in this? Because we are going to make some people unhappy.
Mm-hmm.
And so if everything's based on that, where's our quality? So it's just hard, and I hate surveys, but that's my personal opinion.
Well, Kim, I think it's important to Kim and I had this conversation. I've had individual conversations with people. So when we talked about your experience of the company that was doing your survey, I think that's valuable to share.
We have a company that calls patients, and I normally just refuse to do surveys. But this time I went, okay, I saw somebody in my organization, so I'm going to do the survey. So like 2 months later, when didn't even remember I had the appointment, this lady calls me and she's like, do you have time to do a survey? Did you see so-and-so on so-and-so? I'm like, what? And she goes, can you do a survey? So every question she said, on a scale of 1 to 10, and 1 means this and 10 means this, maybe it's 1 to 5, I don't know. But it was so monotonous. I was just like, oh my gosh, I don't think I can do this. This is more than I can even do. And so it is important to know, how are people getting the surveys? Because just that alone turns you off, and it's just like, I'm going to hang up now. So that's the thing that we had talked about.
Yeah, and I like the idea of like a secret shopper. It's just like, okay, I'm going to get the survey and like be the recipient of that call. So for those of us who have companies doing our calling, it would be interesting to be able to be a recipient of that call to evaluate how that company is doing for you, your third party vendor, because that's, you're trusting them to ask questions in a way that's engaging, and inviting the feedback, and yet neutral, like not leading them. When you say they're great, you can't, of course, do that. So I appreciate Kim. I'm glad you were able to hop on to, because I was thinking, oh, I wish I had Kim to share um, her experience with, and her thoughts about survey, because I really want us to have open sharing. That's the point of having a shared learning webinar. Um, but finding a way, one of these listed creative ways, and like maybe thinking about it after our meeting today and going back in and finding those links and kind of looking through like what might be a good fit for what you're doing, because it's true. Like, you do have commissioners that it would be nice to be able to convey somehow a message of the quality of the care that you're delivering. So also, there's other groups, so sometimes payers, I know for clinics, they have expectations of that you're working on your scores and you're showing some kind of improvement. Accreditation, accrediting bodies, we don't have one for MIH, but they're out there for the clinics, and those recognition programs or certification programs, accreditation programs, often want to see how you're soliciting feedback from the people that you serve in your programs. Of course, so if we could find a creative way to really capture that, I think it would be a huge advantage to your programs and your clinics. So Molly, I saw you joined later. I already spoke for you, but one of the things I said was like, according to how you gather information, sometimes there's nothing you can do about it. So like with the patients that had limited access to primary care, that's an ongoing trend. And for such a long time, they're, just trying to maybe improve communication with that, or, how you set expectations would have been the only intervention. But then now you've opened the Bridge Clinic this week, so, and that's a great response. So I don't know if you want to add anything to this conversation.
Yeah, I think I would just echo what most are saying. We take our survey results with a grain of salt. Typically, you either get the ones who you blew out of the water or the ones who are livid. The masses don't tend to respond. No one likes a survey. So you kind of have to take that with a grain of salt. We track trends over time. Those seem to be more telling, and also, combine it with what we're hearing from our internal teams. We get frustrated with our lack of access. What we're hearing from our external teams, Cody can attest, there's frustration with our lack of access, and we get feedback there too, and kind of take the big picture. So our surveys are used as part of, one small piece of a very large puzzle. And then, try to pull out and separate anecdote from fact. We definitely validate and verify, because the one angry customer, I think, that was pointed out, we definitely don't want to make changes to something that is working well. And then, just over time, collecting that data, make changes, and some can be done quickly and some take years of frustration and advocacy to get there. But we did just open a new clinic, a pilot in Tri-Cities, to see if we can improve access for discharges and primary care by just bridging care for short term. And so that's exciting. And if it works here, we might open it in Walla Walla. They have very similar access problems there. And that is just one example. We do have multiple contracts where value-based contracts where, like you said, Laura, the surveys are listed on there. The scores on our surveys that they tend to focus on is like, did you understand your instructions? And so there's a lot of provider frustration. You know, we gave it, we've done it, and they still don't understand. And so, you know, we can't sometimes do stuff. We end up just creating a bunch of scripting that we give our MAs and just say this on repeat so they understand that they did get the education and they recognize that when the survey question's asking them, oh, that's right, they told me I got the education. It can be very, very frustrating.
Yeah, good examples. I appreciate the conversation. I remember the days of trying to respond to all of that. And then as a clinic director, you're also required to respond within a time frame, and you're so busy. And so it's just really hard. And many times when you're responding to try to talk with an individual, they're not hearing you even in your response, that like this, nothing's going to satisfy. So it's a hard thing, but there's also some good things. Like I also recall a time when we had a definite trend of people that said we can't, no one answers, there's too many rings when we try to ask questions about our bills. They had the wrong number. There was like the number that was printed on their bills to call if they had a question was the wrong number. We would have never known if we didn't have that feedback opportunity for them to provide. So I know that's a pretty sad story to share, but I'm not going to tell you who it was. So, okay. So just to quick, I wanted to give, if Marianne or Bobby, I haven't had a chance to speak, if you want to add your thoughts to this conversation.
I don't have too many thoughts at the moment because we're not doing surveys yet. I know I get lots of feedback from my families and the people that I work with about how, you know, wonderful they are, or we are, or whatever. But yeah, it's one of those things I just haven't done yet and haven't put in my workflow yet.
We are also not doing surveys at the moment. I've thought about how best to deliver those. I just feel like they wouldn't be accurate if I did a paper survey and I'm standing there waiting for them to return that survey. So we've talked about, you know, mail out surveys. I feel like a text service would probably be best, just because me personally, I'm most likely to respond to a quick text for any surveys that I personally do, which really isn't very many.
Thanks, Bobby. I appreciate that. Okay, I think, did we get everyone? Michelle?
Yeah, I had one.
Oh, go ahead, Marianne.
Oh, sorry. I was just, when we talked about the exit survey, I kind of giggled at it because a lot of times my people exit because they're dead now. And it was like a little late, but, you know.
That's what we said too. I know.
Yeah.
Yeah. Thanks, you guys. I see Danielle. It says Chief Troy Jackson, but that's Danielle. So she said they dropped the survey off and they find that their patients don't have the tech knowledge for their message, but they try to adapt always. So Michelle Sullivan, you've been doing this for a while. You've been looking at surveys and data and trends. And so do you have, from that great experience of yours, anything to share?
Sure. So yeah, we have been doing surveys for a really long time, since like 2000.
And I should say, Michelle, you're from Yakima Neighborhood Health Services.
Sorry.
So.
Yeah.
I didn't introduce.
So when we first started doing them, we did them in ourselves. So we would deploy staff to sort of meet the patient in the waiting room as they were leaving their visit and fill out some questions. You know, we found that if they had been here for like an acute issue, an illness, you know, they were not in the mood. They weren't feeling good. Their child wasn't feeling good. They didn't want to fill out a survey at that point. We ourselves tried making the phone calls for the surveys, and it was very time intensive. We now currently use Crossroads, similar to Community Health of Central Washington. and are really pleased actually with that process. We send Crossroads our kept appointment lists for medical, dental, and behavioral health. And each quarter they contact and complete surveys. We get about 220, 230 completed surveys each quarter. And they do go through sort of their series of questions that's roughly based on the CAPS survey. But we have also been able to add questions as we have needed to for things like our health center program, particularly for the Bureau of Primary Health Care. They wanted to know about our nominal fee and how affordable was that for our patients. And we didn't have a set way of collecting that. So Crossroads added a question as to whether the nominal fee had been a barrier to them accessing care. And so now we're able to, show we are getting input, and then that can inform where that nominal fee might get set. In terms of sort of like negative feedback, I do get the direct patient feedback through Crossroads if it is of a negative nature, with an opportunity to, act on that. While they're surveying every morning, I get an email from Crossroads. Here's the, the comments. And, I do investigate those. I might send those out to the department leads for that if there's concerns that are founded. Sometimes, the concerns are not founded, but if they're founded, definitely we do follow up on that. One difficult part, if we want to attribute that back to a provider or a location, is that while the patient is being asked about one particular visit, they tend to group their whole experience together for whomever they saw, for however long they've been coming here. So you can't really say it was this particular provider at this particular site. They might be answering questions for a medical provider, but the comments that they're giving are from the dental provider that they saw. So you can't really, attribute it quite as cleanly as the visit that they are being surveyed about. But their general feedback about the organization, I think, is helpful. And I love the fact that Crossroads analyzes all of it. And they've been very, very helpful when we've needed something different or extra. We just did our patient-centered medical home renewal, and NCQA did not like the question that we were submitting as our patient feedback, and they needed a different question, and Crossroads was able to pull all that data for me for the sites for the previous year and get it to me within a day. So that was really helpful.
Yeah, that's excellent.
Yeah, not something that I could go and do that quickly.
Yeah,
so.
Good feedback.
Yeah.
Any questions for Michelle? I really appreciate the group that's on the call today and has offered their experience and honest opinions. It's really helpful. I love that, and I want that for this group to be able to just know that this is a place that you can come and, instead of just hearing a PowerPoint of what you're supposed to do, but to really gather some information to decide what is best for your organization. So appreciate those who have shared and who are newer and have good questions, and those have been around a long time and are willing to share their experience. So that's pretty much it for what I have today. So we have a little bit of extra, and I appreciate your time very much. So thanks for joining. We'll see you guys. Bye-bye.